Evening, everyone, and thank you so much for joining us. I'm Deirdre Mendez. I'm the director of the Center for Global Business, and it is my pleasure to welcome Andres Gutierrez this evening. He is the CEO of Carmen Health, and he has some fascinating insights about international business to share with us. Andres has a fascinating bio and numerous awards. He has won the Endeavor Entrepreneur Award. He was named the NASDAQ Milestone Maker, the EY Entrepreneur of the Year finalist, and he was named one of Forbes Mexico's 30 Promises. This evening, we're going to hear from him about his career, which has recently included a cross-border expansion of Carmen Health, which was a Mexican company, into the US. Andres has a diverse background in terms of industrial affiliation, which we'll hear about. But in terms of education, he is 100% Longhorn, I'm proud to say. He has both an undergraduate engineering degree and an MBA from UT. And so, Andres, welcome. Thank you so much for being here. We are looking forward to hearing about your journey.
Thanks so much, Deirdre. And indeed, I'm very proud Longhorn, I guess you could say twice baked, and also proud Texican.
So there is so much to talk about. When we've talked about this presentation, we have never run out of fascinating things to discuss. So I don't want to take too much time on any one thing, but we should hear a little bit about your background. Can you tell us a little bit about your path to where you are now? You started out in aerospace and telecommunications in large companies, right? And so how did you then find your way to entrepreneurship and healthcare? What prompted you to make that transition?
Well, thanks, Deirdre. I always, since I was a kid, and by the way, I'm a product of the 80s and 90s and 70s, in fact. And so I grew up in Mexico City and always an entrepreneur, went to a family ranch that had an apple orchard, and I would go back home and I would sell the apples. Or believe it or not, there were no McDonald's in Mexico. So when I was very much of a kid and I saw a McDonald's, and with the abundance of ketchup packets, I was like maybe 5 or 6. I would try to sell them on the stand. I thought that would be, instead of a lemonade stand, a ketchup stand. So those were my early ventures in entrepreneurship. And then going to Texas mechanical engineering background, everything that I've done, so to speak, has really prepared me for this. Both growing up in Mexico, and then having to move to the U.S., moving there, and seeing the differences, and just having to learn to operate in different environments, and basically make friends, and at the same time be myself. In from mechanical engineering, got a chance to intern with Procter and Gamble, incredible company. Telecom, as you mentioned, SBC Communications, now AT&T, where I was a very young engineer and had leadership opportunities with Cruise. Then the early internet, SBC Yahoo Alliance director, and then when I had an opportunity to go back to get my MBA, one of the best decisions I ever made. I was recruited by an aerospace company that, by the way, at the time was private equity held, part of the Carlyle Group, and just recently IPO'd. And there I was vice president of government and military, and had a global clients. And so there I learned a lot of things as far as working with governments, government tenders, certainly highly regulated environments. And in one of these sales, as I was had an opportunity to leave the company, I said, okay, what am I going to do? And so I set up a consulting shop in aerospace. Was doing quite well, but just the knack to help people was always there ever since I was a kid. I wanted to be, like many kids, many things, including being a doctor, helping people. And so that was a burning desire. Second thing is I wanted to build something that had a lasting impact. And then third, romantically, I had an interest to go back to my native Mexico. And all of those things then came to a head when I met an acquaintance, and he said, "Hey, you're from Mexico. You help companies grow. I'm in the medical business, and I'm looking to do surgery centers in Mexico." And he mentioned a word that I'd never uh, heard before, which was hemodialysis. And so I quickly told him, "Hey, your venture sounds really interesting. Yes, I am from Mexico, but I've been fairly removed, and I know nothing of medicine." And long story short, we kept bumping into each other, and then I had an opportunity to go with him to Mexico. I happened to be a pilot, and so he was asking how to get around in some of the places in Mexico where he was going to go check things out. And I said, "If you can go on these dates, I'll go with you." And that's where I saw this tremendous opportunity in healthcare and dialysis, and specifically chronic kidney disease. And I said, "Okay, this is something that's worthwhile and very abbreviated." I then came back from that trip very energized. Still had my consulting clients, but I was literally moonlighting with my friend John Shepard as to how to make this thing happen. And so that was the early beginning, and that was late 2010, early 2011.
Okay, so if I remember correctly from our previous conversation, you started out as a consultant and then you moved into greater and greater levels of involvement, right?
That's right. And so it was great in that. So from business school, you learn several things. And in fact, my grandfather used to say, "Find a need and fill it." And so the need was there. Certainly health is one of the most important riches that we can have, and access to healthcare is one of the key items. The second thing is how are you going to solve it? And so in this trip, we saw a lot of clinics that were, we'll call it suboptimal. And by the way, that's not just something that's in Mexico. That's something that I've had an opportunity to travel to different places, both North, Latin, South America, Europe. And it's a common item that many of our health facilities are below standard. But some of these ones that I saw were there. And so I thought, okay, well, being an engineer, process wise, we can do it better. And then the other thing that was quite impactful was just the access. The When we were in our trip visiting, saw many occasions of individuals getting denied access to therapy, including a mother who was there with her 21-year-old son. He had just, I guess, fallen acute from the disease that was going to be his first dialysis treatment. And as the nurse is coming to give us the tour of the clinic, and almost in the same breath, she tells the mom and the son that was in a stretcher, "Hey, come back tomorrow. We're shutting down for today." And so that to me was very impactful. And so access to quality was there. And then certainly the next entrepreneurial question is then how do you make money? And so in this part, as far as being a consultant, et cetera, we're looking at, okay, how much does it cost to invest? Uh, Certainly doing all of our pro forma and profitability analysis in terms of that. And with John, we went to talk to a lot of venture capital and a lot of angel investors. And their questions were, in addition to the business model, they often compliment us because, again, chronic kidney disease is a massive global health problem, and access to care is huge. But they would ask, "Okay, well, where's your clinic?" And so we would show them the render on the PowerPoint, and then they would ask, um, "Well, who's going to operate it?" And so we would both look at each other. We'd be comfortably in Texas, and so naively, innocently said, "Well, we'll hire a manager, this was to put him in Mexico, in central Mexico, and so that was not going very well. And then the third question was, okay, well, how much of your own money are you going to put into this? And that's where really started stuttering more than usual. And make a very long story short, at that point, then ended up selling my house, moving from Texas, building our first clinic in Querétaro, Mexico, and that was in 2011. And so you could say that indeed went from a project of interest to then fully involved and fully invested.
Okay, and it worked. And so fast forward a little bit to you're a going concern in Mexico, you're up and running, but that wasn't good enough. You had to move abroad. So, but to the US, right? So the US healthcare industry is famous for its complexity and its high cost. So what was the opportunity that led you to this cross-border expansion from Mexico into the US? Why did that seem like a good idea?
Well, I'll have to digress a bit because there's about 10 years worth of experience between 2011 and 2021, 22 when we came to the US. And so and by the way, the thought was always that if we grew Mexico, that the opportunity was national in Mexico. Today, I'll fast forward to today. So today, from that first clinic that we had in 2011 in Mexico, we cover a 6-state region. We're the third or fourth largest operator in Mexico. We're highly differentiated in terms of our patient-centeredness, in terms of that we go beyond dialysis. We've got a very active screening program, management. And very proudly, we are at the Mayo Clinic affiliate in Mexico. We are at the American British Hospital and have a network of independent clinics. And true to our business model, one of the other business school questions was, okay, well, who's your segment and who's your target? And so, which has to do with geography is a segment and is a target. So the U.S. and Mexico, obviously. But at the time when we were starting, we were focused on Mexico, and really kidney disease being a disease that unfortunately does not discriminate. I mean, it's unique in terms of it affects anyone of any age, any socio-demographic background. Unfortunately, it does impact individuals with lower education and lower socioeconomic, lower access. And so for Mexico, our model was to attack the lady of the Mercedes, both the Mercedes bus and the Mercedes sedan. Those are both basically both extremes of the socio-educational spectrum. And that was not going very well because we had to get access to the government payers. And so the expansion in in Mexico, a lot of the healthcare is private pay, but something like dialysis is expensive. And so we had to figure that out. We had to figure out the government contracts. We had to figure out the growth. And we over the years refined a program that was basically patient-centered, very low cost, and very high quality. And as we had this network of clinics, this growth path, I must say, an incredible established leadership team, incredible nurses, medical doctors, et cetera. Something happened in 2020, which was the pandemic. And so during the pandemic, basically our medical director at the time, we had an all hands call. We were looking at what things were going on, and basically all non-essential staff was not going to be part of the clinics. And so certainly I was not essential to care. My job as CEO is to take care of our team that takes care of our patients, but certainly, and it's a good thing, I'm not there cannulating our patients. And so everybody went work from home, and we were remote. And so that was a first segue into the U.S. and also into managing a company remotely, and we had to have very strong people, process, and systems to do that. The next thing that was going on is, in addition to a lot of the uncertainty that was going on, and by the way, for us during COVID and the pandemic, kidney disease is a secondary factor to COVID, and so there was a spike in cases, a lot of issues, and my daughter and my wife had moved back to the States. And so that was a very important, also personal fact that I was then, when I was growing up, I'd go from the States to Mexico. When I was in school, I'd go from Mexico to the States or vice versa. And here again, I was going back and forth to the US. And so you started saying, Deirdre, the US healthcare is very big. It happens to be $4+ trillion of healthcare. Something like 16 to 18% of GDP goes to that. Very, very expensive. And so as looking at Mexico from afar, looking at our clinics from afar, and in the States, and now getting re-immersed into doing things like going to a general practitioner, going to a specialty consult, and just seeing the wait and the time that had to happen. And then also being in the industry, going and visiting clinics as a mystery shopper type of thing. And then I saw that, some of the same things that initially saw in Mexico as an opportunity, saw a lot of clinics here in the US that unfortunately one could say are dark, dingy, and depressing. And so that was one light bulb that said, okay, well, could we implement the very accessible, very fresh model that we had in Mexico to put it up here? And then there's in the kidney space, there's two players that dominate about 80% of the market, or really three of them, but two of them is 70%, and then the third one is about roughly 80. And so it's a very, very concentrated market, and basically for any new provider, any startup, any incumbent, any non-incumbent, certainly the barriers to entry are enormous. And so that's where the idea to then start targeting rural underserved, if you look at a map of the US and look at the clinics, most US clinics and most specialty healthcare services happen to be very close to metro areas. If you start going into the peripheries, you start seeing healthcare deserts. And by the way, a lot of these places happen to be cities, municipalities, towns that have a Walmart, that may have an H-E-B if you're in Texas, but that don't have this type of specialty care. And so individuals that require that are having to travel long distances and hours to and from. And so that was the next thing. And then the last thing in terms of the pandemic and this coming back to the States that was very interesting is, with healthcare becoming a lot more personal, things moving to the home. So before you used to go to a Blockbuster store, now you do Netflix. Well, a lot of healthcare is not quite there, but a lot of it is going with telehealth, with apps, et cetera, is going more towards home. And so looking at competitively and how the service is provided today, a lot of healthcare being not just done in hospitals, but in big facilities that require a lot of capital. Well, if patients are going home, the question is, do you really need all that capital? And so with COVID, we saw a lot of the restructuring of retail spaces. And so that was the last part of saying, hey, we could go target rural underserved areas. We could have something that is in a retail shopping center where most people go shop and live versus a standalone expensive building. And to differentiate ourselves, we could still go with our bumper sticker that we had in Mexico, which is we want to be accessible, effective, and dignified, and that's basically the same thing. And so having an accessible, effective, and one could say delightful model, and going beyond just dialysis, because if you talk about dialysis, really that's almost the absence of health. It certainly is. The technical definition is end stage renal disease, which sounds horrible, and that really to us, thinking of this differently and thinking of this long term, uh, particularly with a lot of the innovations in terms of access to medications, a lot of the diabetes therapies that are having a lot of impact. Certainly, um, uh, implantable kidneys, xenotransplant, et cetera, think that perhaps dialysis is going to go away at some point, but certainly human beings being born with kidneys getting impairment from multifactorial reasons, that's probably going to still happen. And so that's when we then said, okay, we want to be Carmen Kidney Health makes a lot of sense in the U.S.
Wow. Okay. So I really see your MBA working there overtime because there's a lot of analysis there. Um, every now and then you hear about a company that was really helped in some way by the pandemic and took good advantage of it. And this is certainly that kind of story. I also love that the um, locating in rural areas both served a need and served as a differentiator for you. So, and I've seen the photos of your Lakeway. Your most recent opening was just a few weeks ago in Lakeway, right? And I couldn't attend, but I was very interested in the photos you sent. And it's bright and it's colorful and it's, it's joyful. It does not look like a depressing place to go and spend several hours because dialysis takes a long time, right? You're not just in and out.
Yeah, it's that's right, and I'll say a couple of anecdotes, and actually both for Mexico and the States, because exactly almost at the same part of the journey they started. So as a founder, and by the way, as now having been a decade plus in healthcare, I could consider myself a healthcare professional, but I'm not a doctor, I'm not a nurse. And so for me, it's quite humbling to have built something that is providing life well-being, that's providing this life-saving therapy at the hands of these amazing individuals with this incredible technology in terms of the machines. Certainly magical from an engineering and biomedical standpoint. And so to then be able to then walk away from a clinic, and so we had just started in Mexico. Again, I was very new to this, and it was about to be Christmas 2011, and so I had not taken any time off. And I told the team, okay, I'm going to go take some time off. And between the flights, I was obviously disconnected. I called back in to check in on how the patients had been, and was told that one of our patients, his name is Raul, by the way, he's still with us, treating with us, said, well, no, he's still here. And normally, when a patient stays longer, dialysis happens to be, in general, 3 times a week, typically a 4 hour time frame. And so this was well after he should have gone. And so I thought, oh my goodness, something's happened. And the answer was no. He wanted to stay to finish watching his movie. And I was like, really? Okay. Well, that's a pretty cool and relieving kind of story. Similar story, analogous story up at Lakeway. I happened to be visiting in the afternoon and see one of our nurses with one of our patients, and they're having the most engaged conversation. Certainly, they're talking about politics right now, which is something challenging and dubious to talk in the workplace, and certainly with a client or patient. But it was such a great moment to see this connection and this conversation. And so for us, we take seriously this bumper sticker of accessible, effective, and delightful, because nobody really wants to spend time in going to the doctor, particularly if it becomes something chronic where you're having to do it multiple times a week. And so it's not just the layout and the environment and the music, the background music, and certainly the smells. And also, we're now testing things like, can we put virtual reality goggles and the patient can go on a trip, literally, figuratively, or we have bikes where the patients can do some exercise while they're on therapy. And so really, we try to put ourselves in the shoes of our patient, really borrowing a page from what you could say is a Bezos, Amazon, this really looking at who your consumer is, and trying to make that experience the most delightful in something that often can be pretty challenging and depressing, which is the absence of health.
Okay, so that sort of leads to that patient experience. How did that translate for you? What were some of the challenges that you had, and maybe any surprises that you encountered in translating your model from Mexico across to the US? Did you make any missteps? And I'm not just talking about patients, but obviously backing up to your business model. Did you make any mistakes? And how did you have to adapt what you were doing for the US market?
Wow. So missteps and adaptation. How long is our Zoom, Deirdre? So because that's one of the things that as an entrepreneur, and there's many cliches that I think happen to be true. One of them is that if you're not making mistakes, you're probably not trying hard enough. If things seem under control, you're probably not going fast enough. And so certainly there's been a lot of missteps along the way, and it really starts with um, in our model. If you look at, we have the patient and patient well-being at the very top, and so we're very much of a principles-based organization. Sometimes it drives our team crazy because folks that come from the outside is, okay, well, what is our policy, or what's our procedure? And it's like, hey, our policy is to comply, delight, and scale. And so all the rules and regs have been written. And so, interestingly enough, I spoke about my background in government defense. The rules are pretty spelled out. In the United States, we have the Centers for Medicare Services. We certainly have the FDA. We've got OSHA. We've got Texas Health and Human Services, and a similar and analogous alphabet soup is there in Mexico. So. Understanding the law, following the law is pretty critical. And so that's always been something that, by the way, we've done pretty well at. A lot of the missteps have been in terms of, we'll start with financial management. So any company and any entrepreneurial, you really got to understand where your costs, you really got to understand all your inputs. And another cliche, if you think whatever your budget is and time frame is, double it, triple it, quadruple it, because it just sometimes take longer to bake. And having a real good sense of what your numbers are and where your dollars or pesos are going and coming from is very, very key. And so that's always been something that's there. And fortunately in Mexico, we've had now years of predictable and profitable growth. And by the way, as moving from the financial, I'd be remiss from saying that for us, it's a very, very key thing, because you could say, okay, oh my goodness, healthcare and profits, how can those two live together? Well, first of all, if we discuss patient well-being, that can be defined as longer life, less complications, and so happier, healthier, more productive. If we do that, patient lives longer. We're there to serve the patient longer. Patient has less complications. It costs us less to serve. Patient's happier. It's a virtuous reinforcement for satisfaction and referrals. And so we say that money is not an objective. Money is a result of us doing several key things, and we actually have a mnemonic. Being a pilot, we use checklists. We use lots of mnemonics, and the mnemonic is seré, which in Spanish is to become. We want to become the reference for kidney health, and seré stands for safety, first do no harm, experience, how the patient doing, and do they have peace of mind? What are the clinical results? And really, from those first three, then the last one is economy. And we say that 3 out of 4 is a 0. So we obviously, if we don't have the economic engine, we can't grow, we can't be sustainable. So that must be there. But that really is a result of us doing the first things, which is, first doing no harm, and then certainly being, beyond safety, being effective and being delightful. So, so from that, missteps, I guess, that we've had is really thinking that all patients are similar, or that one size fits all. And so, and that's a real dichotomy, because on one hand, we try to provide, and we do provide, very bespoke care. We have another acronym, which is individualized, multidisciplinary, and standardized. And the first one, individualized, makes a lot of sense, and we have different heights, weights, ages, in all the different things that makes us rich and different as human beings. But standardized. And so for us, standard is different than standardized. Standardized means that we're following algorithms. Standardized means that we've got a protocol. And so it's been a challenge, because from very trivial things like a patient being cold, and dialysis patients are generally cold. But then you ask, you turn down the temperature, and now the staff is hot, or some patients are hot. And so how do we deal with that? Well, we got to deal with blankets, or the HVAC system, or where we see patients. And so I'm giving a somewhat trivial example, but as we talk about healthcare, as we talk about providing it, one of the things that, from my engineering and also my business school background, is really looking at it from a systems engineering and full design perspective. And so then, how can we design these spaces that work for the patient, that work for the staff? How do we look at all of these inputs? And then, very, very important, if we have the principles and we have good people, then we can then enable them and empower them to do the choices. So very early on, and I still get a little bit of this, but it was like, hey, Mr. Gutierrez, or Mr. How I was called, is, hey, can we lower down the temperature? Can we turn it up? And so now, over time, it's like, well, I don't know. Can we? You make the call. So really, the ability to have folks to be very, very clear as to what our mission is, patient well-being, have very much understanding what our principles are, like today, and then just letting them do an excellent job has been, in general, a very good formula. That the misstep has been when we and me personally, as an entrepreneur, I've tried to put in too much and not allowing enough of our magical crowdsourcing that we have. And so then, speaking of people, is another challenge. And I could say that hiring specialized folks, particularly healthcare, is difficult, and it's difficult in Mexico, and it's certainly difficult here in the United States. And so they're understanding their career journeys, their career paths, and also what motivates them. So and sometimes not understanding what are the drivers, and are the drivers really just money? Because at some point, we run out of budget to pay somebody, and at some point, somebody could earn all the money in the world, and it would not be satisfying. And so, really understanding that. Deirdre, I could go on and on with all the messed ups that we've
Okay.
had.
Well, one that you mentioned when we talked earlier that I thought was interesting was the difference between the focus of Mexican venture capital and U.S. venture capital, and the fact that you had to sort of pivot in the way you were articulating your value proposition and your goals and so on. Could you describe that briefly?
Yes. So it's know your audience, and so and know your audience, whether you're uh, treating patients, nurses, or going to venture capital. And so in Mexico, I had the fortune of from being a startup and getting selling my house, getting friends, getting family, getting angel investors, and uh, a lot of funds in Latin America happen to be agnostic in terms of the sectors, or they might have the sectors, like, for example, healthcare, education, and financial inclusion might be their bumper stickers, but then they're really generalist in terms of everything else, or they like a tech-enabled component, but that's about it. Certainly, from our perspective, we had tech-enabled, we had social impact, um, and and um, and something that was the general questions: a big enough market, big enough differentiation, moats, et cetera. So that, I would say, is pretty universal amongst the venture capital. What what was very different, though, in the U.S., and this happens to be when we were coming back into the U.S. in terms of starting the U.S. operations. Our Mexican institutional investors, basically their scope is Mexico, Latin America, and many of them, for those of you that are ever going to be looking for venture capital, the exit is a very important thing. And so we wanted to have patient capital, but in general, most funds have a lifespan, say 7 years, 10 years, something like that. So we were approaching that lifespan, or we've approached that lifespan in terms of some of the funds. And so we needed to raise capital to come into the US. We thought, perfect. We have this great track record of Mexico. And by the way, so what do most investors look at? They look at good projects and certainly good people. We've been blessed and that we've had good people. So the thought, okay, we have this established company that's really a scale up that has these predictable, profitable growth. We have the startup with this great business plan in the US, and it was completely fell flat on its face with U.S. investors. And so, why did it fall flat on its face with U.S. investors? Well, for one, just the scope. U.S. market, $4 trillion, Mexican GDP, 1.x trillion dollars, and so the scope is very different. You see funds here in the U.S. that are hyper specialized, and so not only are there funds that all that they do is invest in healthcare, but they invest in just healthcare services, or just health tech, or just or biomedical devices, or medications, and so a lot more specialized. And then the the fact that we had, again, this two different, not just geographic and different in geographies, but also in the vintage of the companies, made it very dissonant. And so that learning said, okay, well, we've got to split the company, and we really got to focus on whatever we're doing in the U.S. for U.S. type investors, and then for Mexico there. Not to say that we have, by the way, we have U.S. investors in Mexico, and we have Mexican investors wanting to come and invest with us in the U.S. But definitely, that's fundraising is definitely not FUN, and the proverbial saying that you got to go and get 99 no's till you get that 100th yes.
Okay, thank you. And thank you everyone for putting your questions in the chat. Andres will be taking questions from the audience soon. But maybe I have time to ask you one more, which is, have you encountered issues related to tariffs, supply chain constraints, or even compliance with regulations like the Foreign Corrupt Practices Act, which we've been hearing a lot about in the news recently? Do you have any comments on all of that?
Oh my goodness, what a loaded question, Deirdre. And how timely. So the answer is yes. First of all, again, growing up, pre-NAFTA, I'd come to the States to get Big League chewing gum, Milky Ways. Certainly there were no Texas steaks in Mexico at the time, or access to Alaskan salmon, et cetera, and vice versa. I mean, now we can all have mangoes, et cetera. It's very interesting that in Mexico, interestingly enough, a lot of our consumables that we use in Mexico are manufactured in the U.S. and or in Europe. And so that remains to be seen. Fortunately, because of our scale, et cetera, we've been able to get long-term contracts on a lot of it, but it is a concern. We happen to be a distributor for certain U.S. products in Mexico, so we're also looking at pretty carefully how that is done. Many of the machines that we use, a specific model of machines that we use here in the States, happen to be assembled in Mexico. And by the way, those machines cost $40,000. About the same as a car. And a question that we have is, are we going to be able to afford those machines to grow with the tariffs? And so I would say that right now the general answer on the tariffs is that I've personally seen the benefits of being in a free trade environment, and I could say that for us, as well as arguably for the markets right now, there's a lot of chaos, confusion, and uncertainty going on, and hopefully it does get rectified. Hopefully, because it's healthcare. By the way, I'll mention a very recent example with Hurricane Helene. One of the manufacturers of solutions that we use for our patients in North Carolina wiped out the plant, wiped out. And so how do you then supply, not just us, the entire United States? And this plant happened to supply a good portion of the US. Automatically, that plant, fortunately, was a globalized company, immediately started importing solutions from Mexico. And so I could just, think of not just the tariffs, but also the clogging of our borders to get things like medicines, consumable supplies, in addition to mangoes and avocados. So that's beyond so then going beyond the tariffs, we've always entering the new market, and things such as compliance, things such as understanding the law is critical. And by the way, one of the reasons that we started in Mexico, that I started in Mexico, I could have never ever, I think, started being totally naive, totally new to a new space in a place like the United States with that much concentration. So, but in Mexico, because there is so much opportunity, such a truly underserved market, 1 out of 3 patients in Mexico with dialysis don't have access to care. Being a new provider for care, that was very, very well received, and literally learned all the regulations from top to bottom. Interestingly enough, very much a mirror image of many of the Mexican regulations, healthcare to the U.S. Unfortunately, not all providers are like that, and so that became one of our calling cards in Mexico. It is one of our calling cards in Mexico, that not only do we provide exceptional outcomes, but we do everything from the front door, everything to public tender, and they can come, they being any kind of regulator, can come in and visit us at any one point in time. And if they've got any questions, we've got the letter of the law right there. If we have any deviation, certainly we fix it and we address it. Unfortunately, a couple of times, a couple of major times, other minor times in our history in Mexico, we have faced corruption, and we faced corruption with some certain unsavory actors unsavory business actors that, in a way, were being enabled either directly or indirectly by U.S. companies. What did we do? We got our legal drafted a letter to the U.S. legal counsel, and it said, in accordance to U.S. code and FCPA, et cetera, we believe that your operation in Mexico may be doing X, Y, and Z, and we suggest you look at it further. Huge deterrent in terms of things. And also for us as a company having U.S. investment, it was always, and it's always been somewhat of a shield, so to speak, because look, we're going to do things the right way, even if that's a long way from a regulatory perspective. We're going to do it, and so we can't change any shortcuts. Specifically, we can't bribe anybody because, hey, we're an American company, as well as we're a Mexican company, and that's how we operate. So hopefully that answers your two loaded questions, Deirdre.
Okay, well, thank you. That was a very quick answer to a complicated question. So we have a couple of questions in the chat. Here's an interesting one. How do you recover from a failed attempt at gaining funding like the one that you experienced moving into the US? What did you go back to those same investors? Did you, with a new value proposition, a new articulation of your business model, et cetera, did you approach different ones? How did you approach that?
Yeah, I think that for anybody listening, anybody that particularly is in business school, and et cetera, financial knowledge is critical. In fact, this is something that I tell all of our healthcare professionals. It's super important. Just like we have a personal P&L in our households, how much do we bring in and how much do we spend on stuff? It starts by having a budget and having that budget down a P&L. So when funding is there, well, first and foremost, the best defense is having a good offense in terms of customer growth, in terms of customer acquisition, and certainly customer retention. And so for us, it's the ability to get out the word to the patients, for us to be able to charge what is a fair and equitable pricing, and certainly providing this life well-being to keep our patient base. The next thing, it's tightening of the belt. And so really understanding what are your core elements for us, what are the key things to deliver this safety experience and clinical results for our patients, and what things you can't touch and what things you can touch, and the things that you can't touch, well, then are there alternatives, or there substitutes, et cetera. So really doing that, and then, by the way, you mentioned one of the mistakes in as a startup, and particularly when you get funding, it's very easy to get largesses. And so while we never went out and bought the expensive furniture of the dot-com era, et cetera, certainly at times you can be less diligent in terms of watching the pennies. And so when not having access to the funding, you really got to go back and tighten the belt. And then how do we solve it? We've now then solved it through access to getting money that's borrowed. Certainly, as we've grown, we've been able to get better financing vehicles and better access to debt. And then another one is really refining the pitch and refining the story. Okay, well, if we have something that's not resonating, what is it? And is it our message? Or is it the substance? And one of the things that I found is that having a crisp and compelling message is often pretty important. but it also has to be followed by the substance. And so the best way to get investors is to giving them peace of mind of, what are you going to do with my money and where's my money? And so showing them that, hey, we're going to do this, we're going to be good stewards, it's going to go to these projects, and this is how it's going to grow. And particularly being able to show a track record, that's great. It's a lot harder when you're starting up.
Yes, thank you.
There was a question from the audience in terms of AI, and I think it's a fascinating question. And for the folks that have your camera, uh, should I ask who's using AI, or the better question nowadays is who is not using AI? And so it's sort of a question. By the way, back when I was in with SBC, and gonna launch the DSL, I had a group that I asked, okay, who uses the internet? And it's a similar question, because back in the late '90s, mid '90s, a lot of people didn't use the internet or didn't use the internet to shop, and now we would think that unthinkable. Well, there's still people that you ask, are you using AI? And many people say, oh no, I don't trust it or whatever. Well, the time has come. And so the advice that I would provide is that use AI for anything and everything. And so AI is here to stay. AI is better. Certainly, and we use AI in many things. And in fact, this morning we had a conversation with a large AI provider, and we also have discussions as to how we can do more of our own AI tools. But so certain things in terms of healthcare, simply going through documentation of 200 pages of medical history of someone, where you're wanting to know three key facts. Do they have hepatitis? Do they have this type of access? Or what is their birth date, so to speak? Well, AI is a great tool to do that. In healthcare, a lot of trends, complications. And so can we look at trends? Can we look at things that if we know a patient's blood pressure, and we know a patient's um, let's say how much they gain weight between therapies, can that be a recipe for a complication? So AI is done for everything, for a lot of things, clinically more and more, and particularly certainly from business writing, proposals, etc. So we use AI quite a bit.
Okay, super. Thank you. And we have another question. What is the best advice you have for early startups in terms of getting their first sales?
So yeah, getting your first sale is critical, and so that really speaks to product market fit, and having your minimum viable product. And so again, what is the need you're solving? How do you solve it? And then how do you make money? And so your first sale, and what is the price of something? Well, it's the exchange of goods. It's the value that somebody sees for your product. And so being really cognizant of what is that job to be done. Clayton Christensen, great author, rest in peace. He talks about the innovators, in healthcare, the innovator's prescription, the innovator's dilemma, but also lots of books. 0 to 1. I believe it's Peter Thiel. Lots of good books on getting to your first sale. Crossing the Chasm is another one. And so it has to do with getting your prototype. It doesn't have to be perfect. In fact, if your first product and your first sale is perfect, odds are you've gone too far. A famous Y Combinator, one of the hallmarks of entrepreneurship and startups. You look at Airbnb. Well, they didn't have all this automation, et cetera. They were basically spreadsheets. Or you look at Uber. They were an SMS service with taxis. And so getting your first sale is, do you have a minimum viable product? And do you have it's not just that first sale, but it's that first recurring sales that is very key. So how do you get it? understanding it, and lots of hard work and a lot of hustling.
Thank you. And we don't have time to go into the relative success of the ketchup business, although I am really fascinated by that example. But can you tell us where you're headed from here? So you just opened, this was, what was your Lakeway center? It was number what for the US?
Number 3, and so right now
Okay.
we're at our 5th location, which is in Brownsville, and so we have a map, actually a McCombs a group, 4 incredible individuals, did a study for us down to the zip code of where our next clinic openings are. We've mapped the state of Texas. We have at least 50 locations that are pretty ripe. We have another location that we are now targeting. A shopping center is being built in the Austin area, where we're going to be going into, and then really being very opportunistic and at the same time strategic, which is kind of another thing that you've got to be in entrepreneurship. While we have this roadmap of the state of Texas and all the zip codes where we want to be, a lot of the places, like for example, Brownsville, was not in our immediate growth path, but it was in our long-term growth path. But we went there because we have a client, a major a nursing home network that asked us to go down there, and so the opportunity was right, et cetera. It called us, and so what's next for us? A lot of centers, a lot of choice convenience, certainly a lot more towards patients home, and then what I'm also pretty excited are the things that we can be doing ahead of dialysis in terms of our Check Your Kidney program, so that everybody knows where they stand, and then helping manage the disease progression so that folks can keep that at bay and hopefully not have to go on dialysis. And so value-based care, if any of you are interested in healthcare, value-based care is sort of the holy grail of things, and it's certainly a place where we definitely want to go to.
Well, that is a fascinating and really inspiring story. It's wonderful to hear a combination of the bottom line as well as a human focused approach. And we all have our experiences with healthcare, and not all of them are nearly as positive as what you're describing. So thank you. Thank you very much for describing that, Andres Gutierrez, on behalf of the Center for Global Business. I want to thank you for contributing to our Global Impact Speaker Series this evening. And I hope to, where are you planning to open in Austin? Have you decided?
We're keeping it close to, yes, we've decided, and we're
Okay.
keeping it close to the vest.
Well, we'll look forward to an announcement. Again, thank you so much.
Thanks so much, Deirdre. It's tremendous, and it's so incredible that everybody that joined, and congratulations for what you're doing. What starts at University of Texas changes the world.
Thank you.